All right, everyone. Here we are with Dr. James Schaller. We've been doing a few videos with him, and he so graciously agreed to provide very informative information on so many different aspects of Lyme disease and co-infections. Now, this is a really big one that we're going to talk about now, and many people experience this after sometimes years of treatment, months of treatment, what have you. The main topic is, why can't I get better? What are the most common reasons for treatment failures that you see, Dr. Schaller? And can these infections be effectively treated and effectively cured? So why can't I get better?
Well, what I'm seeing is the biggest problem is people feel that because they have a good relationship with their family doctor, and that family doctor or internist or pediatrician may have done some very good work. So I get that. I mean, I took my children to a pediatrician that missed Lyme. There was a positive band on the Western blot, the 93. That's Lyme. That's it. There's no discussion. And she was a very nice doctor. I still like her to this day. But I kind of didn't get that this is a subspecialty. Just like treating AIDS. That's not something you do casually. It is very complex. So the first thing that I'm finding is people, I wouldn't say they're in love with their doctor, but they trust their doctor and the doctor has already done good things for them. But it's really like seeing a retinal specialist or an AIDS doctor. It really is so specialized. So the first thing I see that is wrong is they are not using a Lyme literate MD. And that's someone that has spent considerable time learning how to treat the big B's. I call that Borrelia, that's Lyme disease, and then Babesia, and then Bartonella. Now, the other thing is, some doctors are putting out a shingle when they've only gone to one course or shadowed a doctor for 10 days. I am so much better than I was 6 months ago and so much better than a year ago. I'm a bit embarrassed to admit it. I've added so many labs with new things that I really didn't know. So this really requires aggression and a passion for it. And if it's not affordable, even talking to a real expert once or twice a year, that may actually save you years. All they may do is say zig and zag and stop that and try this. That's it. But that may really make a big difference. So I would be willing to work with somebody that's not 5 minutes from your house. There are quite a number of reasonable Lyme literate doctors that have well over 10 years experience. Some have over 20 years experience, but you will have to drive. They're not going to be 10 minutes away. The second thing is they often believe there's one cause to why you're not doing well. And the ticks carry many different infections. And you never feel them because they inject an antihistamine, a painkiller, an anticoagulant, etc. So people don't notice ticks very often, and people don't notice bullseye rashes very often. So they may look for, let's say, one infection, and the most common one they look for is Lyme, And as we said previously, the standard ELISA and Western blot misses huge numbers of people. And my children were one of them, and they were harmed deeply by that mistake. So the first thing is to realize that if this is a possibility, you got to look for at least Lyme, Babesia, and Bartonella. The other thing is, in terms of why there's treatment failure, is the dose is too low. There's a feeling that you're going to commit chemical battery, either with your tincture or your herb or your synthetic medication. And yes, start low, and you can go slow, but I'm watching people make changes every 3 months. People don't have 9 months to sit around to get better. So sure, start low on Monday and think about going up on Thursday. And then again, the following Monday, you move it. You can always back it down. And the other thing I'm noticing is there's a belief that one thing will kill Lyme, Babesia, or Bartonella. That's just not true. If you talk to Lyme experts, they talk about multiple treatments. If you talk to Babesia experts, and there's not many, they talk about multiple treatments. If you talk to Bartonella experts, and that's a small group, they talk about multiple treatments, which they're constantly revising. So you're going to need to take more than one thing. You might want to compound them into a liquid. There's a lot of creative ways to get around that. But the idea you're going to take the equivalent of a 1 a day and get better, that's not happening. That's not happening. The other thing that's not the patient's fault, but what I'm saying is if you're a Lyme expert, everything is Lyme. If you're a Babesia expert, everything is Babesia. And if you're a Bartonella expert, everything is about Bartonella. And it's shocking how little examination there is for these other infections. So that's not the patient's fault, that's the leader's fault. Now, I used to get annoyed at that, but I think I'm realizing now trailblazers need to be single-minded, but that doesn't mean we need to be single-minded. And so you want to test broadly. If you're going to bother to test, use good labs like iGeneX or Galaxy, DNA Connections, Immunosciences. Some people like Vibrant. I'm still trying to communicate with them. Don't understand some of the reports, but there are a number of good ones out there. Armin Labs in Europe, and there are others that are emerging. So I lost my train of thought.
Well, you were saying that my last note that I wrote down is sometimes the dosing is too low. And then you were following up with chatting about how effective testing is necessary, not just for one infection, but for all the infections, because it's usually not just one infection that's causing these. And sometimes doctors who just specialize on these various things will just focus on maybe that infection by ignoring, and then at the cost of ignoring the other possibilities of infections. But
okay, I'm with you. You want to wave?
give it a thumbs up. You're good to go.
There you go. One of the problems that I see often is a doctor may have a priority in terms of their interest. They may worry more about Bartonella or Lyme or Babesia or whatever, and they test for that more aggressively. Or if it's borderline, they think that's a positive, and that's usually true. It usually is a positive when it's indeterminate or borderline. And the thing that has to be realized is each thing that's found has to be treated, and the treatments are very different. As you may recall in previous talks, the treatment for Babesia is radically different than the treatment for Bartonella. And the treatment for Lyme is different still. There's a little overlap, but not that much. So you don't want to treat one or two things when there are three things present. Now, the other thing that I'm seeing a lot of is all the experts that I respect on Lyme, Babesia, and Bartonella, they all are reporting that the antibody tests are negative initially. That's fairly shocking. That's really shocking, because a lot of people rely on those antibody tests to show your body is attacking these infections as a way to show you have these infections. And what a number of them are doing is they actually treat before they test. And I believe that. I think that's the way to go. I think the best way to check for Lyme, Babesia, and Bartonella is to give some meds for all three so that you squish the grapes under your foot, and those are the infections, and out leaks the fluid, and your immune system jumps, and the antibodies go up. And antibody testing is cheaper anyway, so it tends to work. So those are a couple sample reasons. One other thing is a number of patients that are sensitive to meds and therefore avoid them and are afraid of them is they're not treated for their nausea enough. They're not treated for their diarrhea enough. And Imodium can be your friend once in a while, but also that they have mast cell activation syndrome. So we have these mast cells that, you get stung and you see a reaction, and that's the mast cells releasing a flood of chemicals to help heal that area. Well, Lyme is one of many causes of mast cell activation syndrome. And if you find you're quite sensitive to multiple meds or other triggers, take a look at MCAS and maybe put it in the word images and put it in the word symptoms and triggers and treatments, 3 separate searches, and read a little bit. But there are labs to do that. But if you ask your doctor, can you test me for mast cell activation syndrome, and their eyes gloss over, that's not the person to do that, although they may be open to it if you bring them a list of labs. And I'm happy to give anybody all my labs.
So, one thing I'd like to ask you is early on in my testing for Lyme disease by some various physicians around Boston, they were using some standard testing by these well-known companies that are national. One of them, I could just mention them, Quest Diagnostics or LabCorp, for example, that's covered by insurance. And well, guess what? My labs predominantly came back normal. Meanwhile, like I could barely breathe or crawl or had brain fog. I had every single symptom.
Right.
Now, it wasn't until I actually spent money privately on going to all these let's say, more expensive, private, fancier laboratory and more sensitive testing facilities where we sent my blood, like Armin Labs in Germany. I mean, I should own stock in them by now. And immunosciences in Los Angeles, IGenics.
Oh, I forgot Infecto. I use Infecto a lot too.
Infecto Lab, DNA Connections. There's a few others. Anyhow, it wasn't until I used all of those companies that I actually started getting these really alarming results that not only were just individually demonstrative of an infection, but all of them demonstrated that I actually had similar results. So there was a theme going on, that we weren't just collecting, some random piece of evidence from one laboratory testing facility. No, this was from all of them across the board, showing me, yes, you definitely have very high candida, you have very high Borrelia burgdorferi, et cetera, et cetera. So when we're looking at when we're looking at, let's say, Quest Diagnostics or LabCorp, or these traditional testing facilities that are covered by insurance, and these negative results that are coming back, what should doctors be considering there?
Well, if somebody contacts me, I will literally send them my Quest and my LabCorp order sheet. It's 10 pages, single space, all the codes are there. All the diagnostic codes are there, how to prepare it is there, and that may allow them to have their doctor do more tests. I do use those two labs and they've been helpful, but here's the most critical thing. You cannot use them for tick and flea-borne infections. Once in a while, they're positive. I don't think they're as positive as some studies say they are. I think they're rarely positive, but we don't, if it's you and your kid or your spouse or your loved one or your parent, it doesn't matter what the percentage is. But I do use them for many indirect signs. Mm-hmm. These infections cause huge amounts of inflammation.
Yes.
And there are many types of tests for that. Right. They have huge impacts on hormones. So you may be sensitive because your cortisol is gone or your DHEA is nothing, and that needs to be addressed. You may be fatigued because your free T3 thyroid is in the trash can and they're using 25-year-old reference ranges, et cetera. So there are, I would say right now, the average number of tests we order from Quest and LabCorp is we get 35 tubes of blood and we separate them by 2 weeks and bring a book, because it takes them an hour or more to print them all out. And we do get objective signs. But the thing, my friend, that I would say is they are indirect signs. So what's most common is, let's say the testosterone is low. And I believe in fixing that no matter what your age. I don't agree with this aging gracefully nonsense. Everybody ought to have the hormones they had when they were 25. So in any event, we fix that. It doesn't usually help, but what it will do is it will protect their body from stroke and heart attack and grow bone. But here's the more important point. When they are better, they'll feel better. They won't still feel bad because they have the testosterone of a 100-year-old.
Right. So the main point of carry away from this topic, well, we've covered several points of why can't I get better, but moving right along to the testing methods and well, Quest Diagnostics and standard lab testings that probably the big hospitals or mainstream doctors might use are not going to be definitive for diagnosing Lyme disease and tick-borne infections. I think that's the key takeaway. One last questions I want to ask you, and if you could just give it a short answer. Should all infections be treated simultaneously? Because I know there's a line of thought, oh, let's treat Babesia first, then we'll peel away the onion and treat Bartonella, then we'll treat Lyme or something of that nature. And this is what I've heard from other physicians. And I didn't agree with that approach.
I totally agree that you do not ignore any of these infections, but you only want to do one thing every 3 days.
So like introducing a new medication every few days.
Exactly. And so what I do is I usually start with something for Babesia, then Lyme, then Bartonella, and then increase them slowly as they're tolerated. I do not believe you give it a holiday and just ignore it for a prolonged period of time.
Okay. All right. That's very conclusory. Okay. Well, thank you, Dr. Schaller. I think we have certainly covered a lot in all of our various interviews today. And I know that this information is going to be so informative for people. And I just thank you again for your devoted research. We need more physicians like you out there who are true physicians that really do the homework for their patients. There aren't many, but there's a few of you out there. Thank you. And we really do want to encourage the younger generations that this is a collection of diseases that is affecting your generation, not
Absolutely.
Ours too, Dr. Schaller's generation, mine, but now absolutely the younger generations, given all the new presented evidence of congenital transmission, likely sexual transmission, given that, well, Lyme, spirochetes are a cousin of syphilis. So we do want to encourage these younger generations of practitioners to please go into this because there is need for it.
Oh yeah.
Once you hang up your shingle, you'll probably have about 1,000 phone calls the first day. That's what I tell people. But thank you, Dr. Schaller. So we will continue on every month. We're going to be airing new videos, and they will be both on my website. I'm going to also try to upload these onto YouTube videos for the public to freely Google and watch, but they will also be on my website as well, bandaidlyme.com. And again, you will be able to find Dr. Schaller's contact information on the bandaidlyme.com website for your connection with him if you'd like to contact him or become a patient of his. And Dr. Schaller, just thank you again for all of your valuable information.
Thanks for serving the community, Valerie. It's a great honor to know you.
Oh, it's a great honor to know you, Dr. Schaller.